Lecture number 5. The topic is Principles of Psychoprophylaxis, Psychohygiene, Rehabilitation, and Psychotherapy in the work of a general practitioner. Actuality of the topic. A good system of psychohygiene, psychoprophylaxis is the basis of preservation of mental health of the population. Any doctor of general medical practice should know the main principles of psychoprophylaxis, psychohygiene, rehabilitation, and psychotherapy and be able to use it in medical practice. Definition. Psychohygiene is the science of security, preservation, and support of the human's mental health, which studies the factors and environmental conditions which affect the mental development and mental condition of the person and develops recommendations in order to preserve and promote the mental health. It's a part of more general medical science of the human health, which is hygiene. History of psychohygiene. The concept of mental hygiene appeared in the 20th century when the American Carl Beers, being a long-term patient of the clinic for the mentally ill, wrote in 1908 the book that named The Soul That Was Found Again. In the USA, in 1909, National Committee on Mental Hygiene was founded. In Paris, in 1922, the representative International Congress of Mental Hygiene took place. Nowadays, there are national associations of mental health in many countries. Next slide is devoted to main task of psychohygiene, and the main task of psychohygiene is the creation of favorable conditions for harmonic development and performance of all human mental abilities. Examples: stable family, normal meals, good financial situations, house conditions, etc. Systematization of mental hygiene section. Mental hygiene, as any medical science, has some parts or sections. There are 4 of them. The first section is mental hygiene in general. According to a general aspect, mental hygiene is distinguished into 2 subparts. The first subpart is personal or individual, and the second subpart is public or social. The second section of mental hygiene is so-called age-related mental hygiene. And there are some subkinds: mental hygiene of childhood, mental hygiene of youth, adulthood, and old people. Section number 3, mental hygiene of intellectual and physical labor. And the fourth section here is mental hygiene of life and family relationships. Mental hygiene of education. The temperament deviations begin at an early age, often because of the certain conditions of education. And inadequate education, particularly in the style of praise, contributes to the formation of hysterical temperament. And excessive demands promote the creation of the psychasthenic features. Opposite situation, hyperprotection and neglect in childhood are typical for the excitable psychopath. Education according to the type of, in quotation marks, Cinderella, that means without affection and attention, at constant humiliation, often leads to sleep disorders and the development of neurosis. Thus, the compliance with the mental hygiene norms in the process of education is at the same time the psychoprophylaxis. Mental hygiene of training. The effects of the training can also contribute to the formation of the abnormal traits of children. The first school year is a crucial moment for the child. Here, the child for the first time faces with the new requirements, unusual regime, and responsibilities. It's easier to adapt to school for the children who attended preparatory group in kindergarten compared to so-called home children. To prepare the child for the school properly is not an easy task. Great assistance for the parents in this case can be provided by children's doctors and clinical or medical psychologists in children's clinics. And knowing the individual characteristics of children, they can provide parents with the appropriate recommendations. Mental hygiene of labor and life. Deprivation of employment, unemployment are accompanied by the deteriorating of mental health and increasing of somatic diseases. Labor can not only enhance mental health, develop capacities at healthy people, but also to treat patients. Occupational therapy is widely used in psychiatric hospitals, for example. The distinguish between intellectual and physical labor in modern society tends to the abrasion. However, differences between mental and physical labor objectively exist, which allows to talk about the relevant sections of mental hygiene. Mental hygiene of family and sexual relations. Family represents the small group characterized by a number of specific features. These features are caused by the formed traditions, relationships between the older and younger generations, the unity of habitation, life, and other factors. Family can contribute to the disclosure of the creative human capabilities, encourage person to the useful activity, or hamper the initiative, undermine moral. Marital factors, interactions are. There are some marital factors: physical, financial, cultural, sexual, and psychological. According to the defined formula, the so-called marriage potential is calculated. Marriage potential. What does it mean for us? If there is the main focus of the marriage factors on the family strengthening, the marriage potential expressed by a positive factor. Otherwise, the value is negative. In case of negative marital potential, which is actually the true sexual disharmonies, the family relationships and sexual relationships are broken. In primary personal inconsistencies, always collapses the sexual life, and family disintegration occurs faster than it takes place in the case of the primary sexual mismatch. The adequate level of personal development, maturity of judgment, and emotional relationships is required for a higher level of family adaptation, family good relationships, harmonious development. Prevention of family conflicts. The most effective way to prevent the family conflicts is the careful preparation for the marriage. Through this way, the following is included: taking care of the health of pregnant women, combating all the childbirth disorders, providing all the proper mental and physical development and education of children. Then, special training of persons who are entering into marriage, and diagnostic and therapeutic work in cases of family sexual disharmony. Psychoprophylaxis. And we move on to next part of our lecture about psychoprophylaxis. And as usual, we start from definition of it. And psychoprophylaxis is a complex of measures to prevent mental frustration and diseases. It means initial psychoprophylaxis and also recurrences of the mental diseases. One more definition. Psychoprophylaxis is a branch of medicine which deals with the development of measures which prevent the emergence of mental illness and their transfer into their chronicity. The main tasks of psychoprophylaxis are, there are some of them. The first one is the organization and education of the healthy lifestyle of persons. Then, improvement of their life and production conditions of labor. The third one, overcoming of psychotraumatic situations. And the fourth task is refusal of acute and chronic alcoholic and narcological intoxications. Psychoprophylaxis, as a part of medicine, is also subdivided into individual and social, and primary, secondary, and tertiary. Primary prophylaxis. Primary prophylaxis means protection of health of future children, genetic consultations, measures directed to improvement of the women's health, organization of obstetric aid, early revealing of malformations in the newborn, and medical pedagogical correction. The secondary prophylaxis. The secondary prophylaxis is early diagnosis, prognosis and prevention of dangerous states, early beginning of treatment, using adequate methods of correction, and long supporting therapy. Tertiary one. Tertiary prophylaxis is a system of measures aimed at the prevention of physical inability and chronic diseases. Psychoprophylaxis consists of the following measures, irrespectively of primary, secondary, or tertiary one. And let's have a look on these measures. They are prevention of psycho-violation influences at home and at work. In brackets you can see some explanations, some examples of this measure. It's basis of psychoprophylaxis of neurosis, psychopathy, and some other mental pathologies. Then next measure is prevention of iatrogeny and didactogeny. Next, providing with necessary treatment and psychotherapeutic care for somatic and recovering patients, attention, goodwill, etc. Then, next measure is individual approach to the definition of industrial amount of work after illness, regulation of working condition and life, and performance of anti-recurrent therapy after illness. In the complex of psychological prophylaxis measures, it should be considered both as environmental factors and etiopathogenetic factors associated with the person, caused by person's constitution and premorbid personality characteristics. And here word premorbid, let's explain a definition of this word. Premorbid. Premorbid here means before illness. Before illness or normal personal characteristics with which we can compare premorbid state and current state of the person. And we move on to rehabilitation, meaning of rehabilitation. And as usual, we start from definition of this word and section of medical psychology. Rehabilitation is a system of government, social, economic, medical, professional, educational, psychological, and other measures designed to prevent the development of pathological processes which lead to temporary or permanent disability, the effective and early return of diseased and disabled people, for example, adults and children, into the society and socially useful work. And the final goal of any rehabilitation process is returning the person into society and returning of social activity at work with the help of all mentioned above measures. The task of rehabilitation is to adapt the patient to former or varied working and home environment by training all the preserved abilities of the patient. And one more here, returning to work, returning to home by training impaired abilities of the patient. Labor rehabilitation restores work capacity of the patient with the help of drugs or medicines or, for example, physiotherapeutic procedures. Another kind of rehabilitation, social one. Social rehabilitation is creation of the appropriate environment in family. It means improvement of living conditions, financial support, etc. And restoration of the contact with others, restoration of the social status of the patient. The basic principles of rehabilitation. There are some principles. The first one is partnership. Partnership is concerned efforts of the doctor and patient in setting goals. Without setting goals, it's impossible to be a partner. Next, diversity on influences points to the need to use the different measures of influences. Next principle is connected with the previous one, the unity of psychological and biological methods of influence. Only unity of these measures can improve mental and physical status of the patients, and as the further result, their proper returning into pre-morbid conditions. Then, gradation of the influences includes a gradual transition from one to the other rehabilitation measures. And we should follow this gradation to be effective in our rehabilitation actions. Stages in the process of rehabilitation. And according to definition, we know that rehabilitation is rather complex process, and there are some stages in it, and we should move to these stages in order to be effective in our activities. The first one, stage of reducing treatment. It means recovery of the biomedical status or recovering from the signs of disease, medical signs. Next, stage of socialization or re-socialization. It means recovery of the individual and personal status. And the third stage is stage of social integration or reintegration, recovery of the social status. And as you know, it's our final stage, final goal as a doctors to recover the social stages of our patients. Psychotherapy. And we move on to next part of our lecture that is devoted to psychotherapy. And we start from definition. What does it mean for us, psychotherapy? What is it? Psychotherapy means a kind of interpersonal interaction when the patients are treated with psychological means to solve mental problems and difficulties. And the term of psychotherapy belongs to Russian psychologist Platonov. One more definition of psychotherapy. Psychotherapy is a system of complex verbal and non-verbal therapeutic effect on emotions, judgments, self-consciousness of the person at various diseases, mental, nervous, psychosomatic, etc. Effect on the entire organism and behavior of the patient. And in this definition, the more important for understanding that psychotherapy uses verbal means with the help of words, and non-verbal without words, with the help of appearance of doctor, with the help of gestures, etc. And its complex therapeutic effect on entire organism and behavior of the patient. Strategies of psychotherapy. Strategies of psychotherapy are targeted. It means that each strategy has own target and has own final goal. And let's have a look on the first strategy. The first strategy is reconstruction of the inner world of the patient's individual. It means correction of inadequate self-frustrational stereotypes of experience and behavior, as well as the development of new, more mature and constructive ways of perception, experience, and behavior. Targeted strategy number 2 is reconstruction of the patient's connections with an immediate social environment, the solution of actual life conflict, and improvement of interpersonal functioning. And as you can see, the final goal of this strategy is improvement of functioning or connections with others. Strategy number 3, direct effect on symptoms of the disease by using suggestion and training. And the final goal of this targeted strategy is relief on symptoms of disease and direct effect on them with the help of as verbal or non-verbal measures. There are some types of psychotherapy. The first type is called general. What does it mean, general psychotherapy? General psychotherapy is a complex of psychological factors action on the patient of any profile in order to increase patient's forces in the fight against their disease. And let's find out keywords here in order to understand meaning of general psychotherapy better. General psychotherapy is complex of measures. This complex of measures is directed to any patient with any profile, with any personal traits, with any accentuations of the person, with any somatic or mental problems. But the final goal of general psychotherapy is increase of patients' forces to fight against the disease. Private psychotherapy. Synonym for private psychotherapy is special psychotherapy. There are some kinds of private psychotherapy. They are rational or individual, autogenic training, abbreviation AT. Autogenic training may be individual and group forms of performance. Suggestive psychotherapy, individual or group maybe, and psychoanalytic psychotherapy. Classification of principles for the psychotherapy. And we should follow these principles in order to be successful in psychotherapy intervention. There are some of them. The first is, under acute hysterical symptoms, there is better suggestion. And if you find out hysterical traits or hysterical symptoms in your patient, you should understand that suggestion would be a better one for intervention to this person. Next principle. Under vegetative disorders, there is autogenic training. Vegetative disorders or somatoform disorders. Number 3. Under the life difficulties, there is rational psychotherapy. And you should explain your patient his or her their life difficulties in order to relieve some abnormal or illogical, irrational ways of thinking. Then, under phobias, there is behavioral therapy. Under characterological disorders, there is Gestalt therapy or psychodrama. Under disorders associated with family problems, there is family therapy. It's not individual one, but it's group therapy, group with close relatives. It's called family therapy. Under complex disorders, there are deep psychological methods. And you may combine these principles while working with one patient or with a group of patients. From the set of psychotherapeutic methods, the extra attention should be paid to rational psychotherapy, suggestive psychotherapy, auto-training, and psychoanalytic psychotherapy. In other words, these methods of psychotherapy are main. All other are additional ones. What does it mean, rational psychotherapy? Rational psychotherapy is the method aimed at logic ability of the patient to compare, to do conclusions, to prove their validity. Rational psychotherapy as one of the elements is included into all types of psychotherapy. Without it, the beginning of each is difficult. There are no complications and contradictions. And rational psychotherapy can be carried out as individual or group psychotherapy. In other words, any doctor of any specialty should be rational psychotherapist in order to be successful in communication with patients. Basic stages of rational psychotherapy. There are some of them. The first one, explanation, includes the interpretation of the materiality of the disease and reasons of its appearance. Persuasion is the correction of cognitive and emotional component. And the third stage is reorientation, is the achievement of more sustainable changes in the patient's prescriptions in his or her relation to the disease. Suggestive psychotherapy. Suggestive psychotherapy is a number of methods based on such medical factor as hypnosis or auto-hypnosis. Hypnosis is used in vigil condition or sleep, hypnopsychotherapy, narcotic sleep, narcopsychotherapy. Narcotic sleep means sleep after using medication. Among the methods of auto-hypnosis, auto-training is the most popular one. Definition of auto-training and meaning of auto-training. Auto-training is an active method of psychotherapy psychoprophylaxis, and even psychohygiene. It's directed to recovering of dynamic balance of the homeostatic system of self-regulating mechanism damaged in stressful situations. Psychoanalysis, one more main type of psychotherapy. And psychoanalysis is a psychotherapeutic method developed by Sigmund Freud. Basic focus is upon unconscious processes. Psychotherapeutic methods are used for their analysis. And classical psychoanalysis includes theories of common mental development, psychological origin of neurosis, and psychoanalytic therapy. Psychoanalysis is indicated for treatment of patients with neurosis, personality disorders, and sexual disorders. And it should be told that psychoanalysis is prohibited in acute psychotic state, for example, schizophrenic patients. But it's material for your future course of psychiatry. And some words about psychotherapy in work of general practitioner. Various methods of psychotherapy, hypnotherapy, autogenic training, self-hypnosis, rational therapy, behavioral therapy, etc. are widely used when treating somatic diseases. The main aim is to overcome the recorded anxiety reactions. Psychotherapy can influence to fear, fatigue, depression, hypochondria, as well as neurovegetative, neurosomatic, functional, and dynamic disorders, for example, in the cardiovascular, respiratory, gastrointestinal, and other systems. And control questions. After listening of lecture, you should answer on these control questions. And these control questions you may see on this slide. There are 5 control questions. And please use our site, name of which you can see on the slide, for downloading any material for preparation for lecture and practical classes. And thank you for your attention. The lecture is